From the point of view of communication, it's vital for doctors and nurses, and in fact any health professional, to be able to communicate well with their patients. If it is said that 80% of the diagnosis of any illness is based on the ability of the doctor to communicate and elicit the history from the patient, and then 20% is investigations. Well, the primary tool then of any medic who has got any kind of contact with the patient is then in their communication skills. And a lot of the, you talk to patients, a lot of their improvement can come just from the ability of the doctor to reassure, get a patient to leave happy without the need for medication. I mean, it's not always going to be the case, obviously. So it is of primary importance for the doctor to be able to elicit information in a way that is gentle from the patient, so the patient then builds up their confidence to be able to give information to the doctor, because it's not just about eliciting information, it's about giving the patient the confidence that the information that is being given is for their benefit and not to be used against them. And that is crucial. Well, for example, a patient might come with, say, a sexual health problem or a problem that they don't want other people to know about. If they can't tell the doctor in confidence, then they're not going to give the information. The doctor might miss the diagnosis. It might happen with drug abuse or patients who are in denial about their health situation. A classic example is when people come, they're smoking or eating or alcohol. There's a law called Holt's Law, where patients, they say something, the doctor would double. So I have 10 cigarettes, make it 20. I eat 1 Mars bar, it's 2 Mars bar. I mean, obviously it doesn't apply in every situation, but doctors then have to gauge what the patient is saying, and people are quite frightened sometimes about saying exactly the truth. So if the doctor puts them in a position where they have got confidence in the doctor, then the doctor will be able to elicit information out of them. And so having the skill of being able to ask open questions rather than constantly asking closed questions. Closed questions might stop the patient from giving information, might be like an interrogation at a police station or immigration, whereas an open question might be, you tell me more about it, where the patient tells about themselves. This is patient-centered rather than doctor-centered. This is a problem, and we deal with this in the books, because it's quite difficult to respond to an open question compared to a closed question. A closed question would be the answer yes, no. An open question might say, well, tell me more about the illness. And the patient might say, well, it started yesterday and I took this type of medication, it didn't work, I've had it before, and there's lots of information coming at the doctor, and it's the ability to process this information, which is quite difficult in a first language, even more difficult in a second language, and then in relating the answers to a time sequence. Very simple tenses, very simple language. So you've got eliciting information, explaining procedures, explaining medication. If you explain the medication and then the patient cannot absorb the information, they might not take the medication. The procedure, they might not understand what is going on, the operation. So you've got different types of explanation, reassurance, expressing empathy and sympathy, then making the patient realize that they can come back for more help. This builds up a big picture of all of the skills that are necessary in doctors dealing with communication with a patient. there's also communication with other health professionals, because it's not, each doctor is not they're not isolated. They work in a team with nurses, receptionists, the person dealing with the x-rays, the radiologist. So it's this whole team effort again, which we cover in the book. Medicine One's got a unit dealing specifically with this.